It's 2026. We all know that physical health is so important, especially if you're here listening to a health podcast. We all know that physical health is something that we should be prioritizing, but sometimes we don't really know where to start, especially if we've been off track for a while. I think back to school. I think back to learning anatomy. But what do I truly remember from anatomy? I remember in middle school gym class learning that there's 206 bones in the body. I remember in my cadaver anatomy class, I had to learn the origin, insertion, innervation of all these muscles. When we learned anatomy in school, there was no context other than, could you pass the exam? And especially if you don't work in my field, I think anatomy is very important to understand because we all have a body and we all need to learn how to physically take care of it. But there's no application. There's no context. There's no embodiment. To kick off 2026, your sister, the doctor, she's back for season 2, and we are going to be talking about embodied anatomy. We're going to be talking deeper than the physical. But before we go deeper than the physical, then we really do have to define what the physical is. Because we do know what the physical is, but we don't truly know how to embody that. We don't truly know how to apply the things that we know. We don't truly know how our body works. I see in my patients every day that come in and they have no clue how their body works. I can say for a fact that our education system did not teach us the context of how we need to apply our anatomy as a female. Literally growing up, starting from the age of menstruation into adulthood, how do we navigate our 20s as women when there are concerns about fertility, menstrual cycle, having a family, and then later in life when you're going into menopause? All these topics are so under-discussed, and my patients don't know what to ask their doctors. When my patients come in with symptoms, they don't know that their symptoms are not normal. They know how their body works maybe. They know what's normal for their body, but they don't really understand it on a cellular level. I'm on a mission for women especially to learn about their bodies, but honestly, everyone. And there is so much to unpack, and I'm so excited to present season 2 of Your Sister, the Doctor. The human body is so freaking cool, and it's very underrated. There are so many systems in our body that we don't even really truly understand yet. And we see that in medicine as things are coming out. There's a lack of research in things including women's health. As a little girl, I've always wanted to be a physical therapist, and I grew up and I was always so interested in anatomy and seeking out information about anatomy. But then when I got to anatomy class, I hated it. Not gonna lie, I hated every moment of it. Granted, I was the COVID class and I did not get to put my hands on a cadaver as a physical therapy student until after I was learning. So, I spent 6 weeks memorizing muscles and nerves and all the things, and I did not like that because my brain is a little bit more creative than that. I don't like to memorize information. I like to look up information if I need to. So I think that some of you all may relate to that. My point is that I want to make anatomy fun, and the fun was taken away from me when I was in school. And if you are a STEM girly, if you are a med girly, you understand this. I know my nurses, I know any of my healthcare worker girls. Anatomy is tough. Anatomy was a time. And like neuroscience, neuroscience is so cool. But the class itself in college, terrible. That was like the hardest class in PT school. So yeah, there's like all these things that are so interesting to learn about. What's missing is knowing how to embody these things and knowing how to take what we learn and apply it to our bodies. And a lot of times turning in intuitively does help, which is crazy. You can be your greatest teacher when it comes to some of these things. And I'm going to give you some tools that you can walk away with throughout this season. Be your own. As one of the lecturers in Pelvicon said, her name is Michelle Lyons, and we'll talk a little bit about her. We can do some me-search, so some research about yourself. So you guys are all STEM girlies. We'll get more to that later. As we go deeper together, we are going to walk away with knowledge that we wish that we had known when we were growing up. We're going to walk away with knowledge that your mother wished she knew when she was growing up. We're going to walk away with knowledge that your grandmother wished she knew when she was growing up. And my goal and my mission is to spread this knowledge and to dive into these topics with you guys so that one day your kids are going to be able to learn this from you. You're going to be able to teach your mother, teach your daughter, all these things as women that we need to know how to embody our anatomy and how to embody our physical health and how to take care of ourselves best. And that is my goal and mission with this podcast. My mission really helps me stay grounded. And I've learned lately that being grounded is so important, guys. So as you know, I have actually taken a bit of a break from the podcast, and my season 1 launch was scary, but it was awesome. The feedback that I received was so great, so thank you guys. Seeing myself on people's Spotify Wraps, seeing that people sent it to people that I didn't know, it was really, really cool. So thank you guys. So since we've talked, I have gone to Pelvicon, which is an awesome pelvic floor conference in Atlanta. I did a little series on my Instagram for that. And then before Christmas, I did a little pelvic floor series on my Instagram, 12 Days of Christmas Pelvic Floor Edition. And I went through some pelvic floor topics that I wanted to shed light on. Today, I just really wanted to chat with you about physical therapy and why I'm really truly in love with this field and how I think that my field really applies to my message for this season. As a physical therapist, we are taught in school how to do an evaluation of a patient, to look at the organ systems. Our focus is the musculoskeletal system, so knowing when to refer out when it's not a musculoskeletal issue. Looking at the patient, looking at their function, looking at how they move, looking at their activities of daily living, looking at their gait, looking at their pain sources. There's so many things that go into it. My company really breaks it down and makes it more methodical, which is nice. We take a look at the person's strength, their flexibility, their mobility, all these different things that upon discharge will prevent them from coming back into physical therapy to help with like the downstream cost of care. So basically, when I see a patient and they're coming in for shoulder pain, I'm not just looking at their shoulder, I'm looking at their whole body and I'm seeing how we can prevent that from happening. So not necessarily that once the shoulder pain is gone, that the patient is done with PT. It's like, okay, we're going to get you stronger and we're going to make sure that you can use your core so that you're not straining your shoulder, and see what kind of activities that you do if you're an athlete or if you're a manual laborer or if you're a desk worker, all these things like ergonomics, posture, things like that. And the same thing goes for the pelvic floor, which is really cool. Pelvic floor PT, I always tell people, takes a little bit longer than you would expect because we're working with such deep muscles. So we start out with learning how to breathe, and your breath connects to your pelvic floor more than you would expect. And then we think about things like your bowels and your bladder. And there's actually a lecture that says breathing and bowels, those are your first 2 priorities as a pelvic floor PT. If we can help you with your breath and help you with your bowels, a lot of things do resolve, which is exciting. So some of it is like the habit things that I talked about on my Instagram, if you've seen, like learning how to suppress the urge to go to the bathroom if you're going too frequently, if it's a nervous system response, learning what good bladder habits are, learning how to properly poop, learning, why did I laugh with the word poop? I'm literally a pelvic floor PT and I say that word all day. So there's like the education side, and then I look at the person as a whole, see how they need to function in their everyday life. And then as we resolve some symptoms, then we can move forward and talk about activities of daily living. Like I see a lot of mothers, and when they're lifting their babies, often their posture looks like, I don't want to say really bad, but oftentimes as a mother, you're not thinking about your posture. So just trying to promote better posture and ergonomics while you're carrying your kids, or when you're breastfeeding, a lot of times with pumping, your moms are hovered over all the time. So yeah, I love my job because I take a person, I get a history, I see what's wrong with them, I hear their story, I hear what their main goals are, I hear what they truly want to gain out of PT. I can address anything that I need to physically, musculoskeletal, whether that's internally, whether that's externally. I can help address their pain, I can help address their coordination. I can help teach them habits that will promote a healthier nervous system, that will help promote a healthier bodily function in general. And then we can take everything there and apply it to how they're going to manage this after they are discharged from physical therapy, so that their problem is better than it was, not only better than it was when they came in, but also like prevented from happening again, or they know what to expect if something similar arises, or they know how to manage it, or they know how to prevent it. When I think of that and my role as a physical therapist in that, it's exactly what my goal with this podcast is. It's teaching you the tools that you need to really tune in with yourself and take ownership of your health and give you the confidence that you are able to learn about these things, and that you have resources and you have people to reach out to, and you're not alone in this, but you can listen to your body and you can know when it's time to ask for help, or when it's time that you can take control of your body and the steps that you need in order to get where you need to be. Take ownership of your health, baby. No matter what religion you are or spirituality you are, like, the fact is that we get one body in this life, and our body is the vessel to our being, our soul, and it is very important that we take care of it. And it's so hard because we lose sight of that in our everyday life. We truly do. I mean, when you're running around trying to get your errands done between work and going to the gym and cooking dinner, like, you're not sitting there thinking like, man, how can I support my vessel right now? How can I support my body? Not necessarily all the time, right? Sometimes you do. Like, when things come up, when ailments come up, you're like, man, my low back hurts really bad. Maybe it's my posture in the car. What can I do? But this is something that has been a problem long before you started having the symptoms. And, you know, something that I teach my patients, it's like a threshold. So imagine that you have a solid line here. Okay. So let's take low back pain, because that's very common. Okay. So say you're down here. Okay. And this threshold is when you start to feel pain. So you're living your life, and then you work out really hard. Okay. And then you're living your life, and then somebody really stresses you out. And then, so you're holding a lot more tension than normal, and you're living your life, and then you do a bunch of repetitive bending because you were shoveling the driveway, something like that, breaking leaves. And then you're just living your life, and all of a sudden X, Y, or Z happens. And then there's this one thing that you don't even think about. Maybe you're sleeping and you turn over onto a side and you don't wake up, and now all of a sudden your back really hurts. And then this threshold here, all of a sudden you're here above the threshold, and you're like, man, my back really hurts all of a sudden. What did I do to it? What did I do to it? Prior events have set it up for all of a sudden now you're having this extreme pain that, you know, wasn't there before. Same thing goes with the pelvic floor. Over time, say that you were really constipated when you were traveling, and then your muscles get really tight. And then say that you were watching a scary movie and your muscles get tight. They've actually done studies on that, and that happens. And then say that you were working out and you were holding your breath, and then your muscles get really tight. And then say that all of a sudden X, Y, or Z happens, and you're like, man, now my pelvic floor is kind of painful. What's going on? Or maybe it's really difficult for you to have a bowel movement all of a sudden, or it's very difficult for you to participate in sexual activity. So knowing that there's this pain threshold kind of can give you a little bit of empowerment of, okay, all these things that I'm doing throughout the day aren't necessarily scary. It's not scary to move. I shouldn't avoid doing things because my pain is going to get worse. But maybe we can do things to kind of help bring this threshold down. So how can we get below this threshold? Maybe I teach you how to breathe diaphragmatically in a box breathing technique so that you're meditating and relaxing and down-regulating your nervous system. And then now, okay, your muscles start to relax a little bit. You're still above the threshold. Okay, now I'm going to teach you how to properly poop and sit up on the toilet and breathe. Okay, now my muscles can kind of relax a little bit. There's a little bit of pressure off of it. And then something bad at work happens, and then you're back up here. And then we're just going to keep working until we get you below this threshold. And then once you're down here, then we're going to teach you the tools how to manage this pain here. So it's really cool if you think about it that way. Sorry, I was like nerding out a little bit there, guys. Pain science is so cool, and we're definitely going to have an episode on that this season. Speaking of, as we have been talking about awareness in our body and trying to embody our anatomy, I just want to take a moment to kind of check in. I just want you to notice where you're sitting right now or standing or whatever you're doing. What does your body feel like? And for example, I'm feeling my foot is cramping right now, so I'm going to move my leg. But just check in with your body. Go through a body scan. So start from your toes and work your way up to your head. Are you holding muscle tension anywhere? A lot of times we are. I'm like, wow, my shoulders are really forward right now. What if I just brought them back a little bit? What if I extended through my back a little bit? We spend so much time forward. Can we do a little extension? Movement is medicine. Just kind of for a second, check in. See how you're doing. Do you feel stiff anywhere? Are you holding tension anywhere? Do you feel relaxed? My abs are really tight right now. Why are my abs so tight? I don't know. Just little things like that. Little silly things. Or your jaw, or your neck, your forehead. Sometimes I'm just like scrunching up my eyebrows and I'm like, what am I doing? I think one of my most viral videos that went during my 12 days of Christmas was the butt clenching one. So go look at that if you're curious about me clenching my butt while I wash my dishes. Or my friends doing it. Shout out to my friends. Now I want to kind of give you guys a little bit of sister soul goodness. I have had so many downloads since I've been last on the mic. Something that I learned over this time that I've been away from the mic, I took an advanced pelvic floor course called Capstone. And in this course, we go over manual techniques and just a broad variety of topics in the pelvic floor realm that are more advanced than your beginner basic topics. And something that I've learned is that I really, really took away and came at like the most perfect time, because shout out to Kayla Rose. She did an artist activation workshop. It was over like 10 days. At the same time, around the same time, I had taken this capstone course and art was on my mind. But something that the instructor talked about in this course was how physical therapy and being a pelvic health provider is an art. It's not an exact science. And I think any form of physical therapy can be like this. So you go into a session with a patient and yes, you do have a plan, but sometimes, they're having different symptoms. And as a creative person and somebody who's flexible and who can pivot, it's kind of like an art at the way that you go about treating this patient, which I really love that concept, because when I think back to my younger version of myself, I was so creative. I wrote books. I drew pictures. I was truly an artist, I would say. And going through the school system again, of course, love science, and I am a STEM girly, but oftentimes STEM girlies lose that sense of artistry, if that makes sense. And over this time, I've realized that STEM girlies are artists too. And you have to be so creative to be involved in science. And science is art. Science is truly art. Physical therapy is like any practice. Like you learn the textbook version, just like you learn an instrument. You learn other people's music. And then I got this metaphor from somewhere and I don't remember where it was. It might have been from a podcast or something. But as you gain experience, then you're able to pivot. Just like as you learn how to play the piano, you learn other people's songs, then you can come up with your own songs. So physical therapy, especially pelvic floor PT, is kind of like that in a way. Like I learned how to be a physical therapist, but now I'm able to kind of guide my treatment plans in an intuitive way. So when I go into a session with my patients, I listen to what they're saying, I listen to their symptoms, and I let that guide my treatment. I feel physically how they're feeling. I can feel, the quality of their muscles, their fascia, I mean, in the course, they talked about how when you're feeling the fascia and like letting your hand sink into it, you can kind of, it's an artistic practice. Like, you know how to move the soft tissue, which sounds a little woo-woo if you think about it, but it is so true. It is so true, guys, because some days people need aggressive PT and some days people do not need aggressive PT. And if you get it, you get it. Shout out if you're a PT or any healthcare practitioner. But it's kind of like, imagine that you have a muscle knot, okay? And you really need to get this muscle knot out. There are times where you really need to get the muscle knot out and I need to put my elbow in there and get it out. And then there are times that your nervous system is overstimulated and the fascia is tight, or you had a trauma to the area and maybe you just need a little bit of a gentler manual approach. So, you know, the course was talking about manual techniques, how you're an artist as a healthcare practitioner and that you let your intuition, the patient's symptoms, all of that guide your plan of care and guide your treatment session. But I'm expanding on that and I'm saying that since we take such an individualized approach with each patient, it is like an art. We're trying to create a plan that these people will come away with in PT. Day to day, if you're a woman, you know that day to day your symptoms fluctuate. So what I'm saying about physical therapy and art is that, you know, sessions are not scripts. Bodies change day to day. The nervous system changes throughout the day. Your response to treatment is going to be different day to day. The exact same treatment, your response is going to be different day to day. Pain is nonlinear. We talked about the pain threshold where, you know, an event happens and then maybe you might go up and then you might go back down and then you might go up. So if the pain threshold is nonlinear, then healing is nonlinear as well. Because as I tell my patients, like, yes, we're going to start treatment and then you're going to get better. And then you're going to have a bad day and then things are going to get worse. And then we're going to keep going with our treatment and then things are going to get better. So we're having this upward slope over time. It is nonlinear. And just like tying it into season 1, women are cyclical beings. And as cyclical beings, we have to learn how to work with our bodies. And we have to learn that there's not a one-size-fits-all approach, that we have to be creative, that we are artists. It's so crazy how this is all connected. Am I the only one who's like, whoa, crazy? Healing is responsive. It is not rigid. It is responsive based on how you are in the current day. So treating the body and physical therapy is an art in itself. If you think of the scientific method, if you're having a really good experiment, all your variables are controlled except for the independent one. You guys remember that from science? So when we're talking about human anatomy and women's physiology, you know, there are so many variables that we can't control. So that's why it is such an artistic approach, because it is nonlinear. Women are cyclical. Healing is nonlinear. Treatment sessions are nonlinear. So this advanced course that I took in pelvic health gave me permission and taught me to pivot, to listen to people's symptoms, to trust my clinical intuition. Because I have experience and I went through school and I did learn all these things. And to work with people's bodies and not against it. Just like I need to work with my body and you need to work with your body and not against it. And this is why learning anatomy and embodying it is so important. So this goes back to the beginning. This all circles back to the beginning. And my point is that learning anatomy is great, right? It's great. You should learn anatomy. I'm not saying don't learn anatomy. I'm saying my love was not in learning anatomy. I did not like learning anatomy. I love anatomy, but I did not love learning it. But once you know it, once you understand it, once you have experience working with patients, then you know how to approach and apply and look things up and use your intuition. I've learned that STEM girlies are creative too, and I'm sure that you can apply this to other STEM fields like engineering. Let me know in the comments if you're an engineer and you're listening. Shout out to my engineer friends who listen. Okay, man, that was good. That was like church, baby. Okay, we are in the final section of the episode, and we're going to go through a Q&A, and this Q&A ties in so beautifully to the rest of the episode, so we're just going to get into it. So this is a question from my dear friend Madeline. Okay, so my question is,
is, if someone has been experiencing irregular periods, what are some actionable steps they can take to try and get a more regular flow?
All right. Thank you, Madeline, for submitting your question. And Madeline also asked a little bit about supplements, so we'll get into that as well. So when I went to Pelvicon, there was this instructor named Michelle Lyons, and she is amazing. And her lecture was on being the menstrual detective. And of course, I was like, oh my gosh, let me take notes. I'm sitting back. I'm so excited because this is like my favorite topic ever. We're going to have a whole episode about this, guys, because I'm going to rewatch the lecture and we're going to take notes and we're going to go through all of it. So Madeline, to answer your question, how do you regulate your menstrual cycle? Step 1 is to simply track. Simply track your symptoms. And I know that's frustrating because that takes time. And I know that that's not going to solve anything immediately. But according to Michelle Lyons in her lecture, and she is the expert on the menstrual cycle and pelvic floor, you need a minimum of 3 months of data before we decide what we need to. And that's frustrating. That is very frustrating because, you know, who wants to sit there and track things? But you need to know your body before you could apply anything first. So what are you tracking? Exactly. You're tracking symptoms, your bowel movements, your sleep, your pain, your mood, your performance, if you're an athlete or you just work out in general. You're going to track your cycle length. So day 1 is the day that your period starts. And then you're going to track all 4 phases. Track when you ovulate. You can refer to one of my previous episodes where we talk about the different phases of the cycles. You're going to track your period length, how long you are bleeding, how long the period is. So you got the cycle length. So we're talking about all the phases of the cycle. And then you've got your period length. And then you're going to track your ovulation. And that could be through, you know, the cervical mucosa that you see, or your basal body temperature, or an ovulation stick. You're going to do some me search, as she claims. So me search is doing research on yourself, basically. So you're going to be your own scientist. You're going to be your own STEM girly, and you're going to track your symptoms. Okay? And then we take it from there. Something really interesting that I wanted to bring up from these studies, guys, and I know that symptom management isn't always regulating your period, but sometimes it is regulating your period, because a healthy menstrual cycle should not be painful, contrary to popular belief. And managing PMS symptoms is very important. There was a study done in 2021 that showed that drinking 1.6 liters of water daily showed significant difference in pain levels for women who didn't. 1.6, I did the calculation, 1.6 liters, that's about like 60 something ounces of water. That's like, we should all be drinking that. This study showed that there was a decreased use in painkillers of those women just by drinking water. So some of it comes back to like the basic things that we talked about in the recipe to your wellness, like drinking water. And in another study, which was very interesting, talked about using heat on the lower abdominal region. And it showed that heat is just as effective as taking NSAIDs and more effective than taking acetaminophen or Tylenol. And I'm going to dive in a little bit more to some of the menstrual science in upcoming episodes. So, Madeline, to answer your question, in order to regulate your cycle better, it depends on a lot of factors. And there's no straightforward answer, honestly. Start with tracking and start with managing your symptoms. Okay, if you're having symptoms. Madeline was asking a little bit about the supplement called myo-inositol, which some of you may have heard of. I've been taking it for over 6 months, maybe close to a year. And this supplement provides reproductive and metabolic support, essentially. And it's really helpful for people with PCOS. It's helpful for people with hormonal imbalance and fertility issues. It can help with insulin sensitivity, which is why I'm taking it, because my insulin was a little bit high. So it helps control your blood sugar. It may help with anxiety, depression, things like that. It can help you with fertility it can help you with cellular growth. Taking something like that, the research is still ongoing, but it is recommended by nutritionists and doctors, and there's not a whole lot of adverse side effects that I know of, at least. So let me know in the comments, like, kind of what you think. After taking it, for me personally, my insulin sensitivity has gone down, and it could be a combination of diet and taking the supplement. As far as regulating my cycle, I have not particularly seen that in me personally, but give yourself a few months on it and see, does it make your cycle a little bit more regular? I'm sure that it is something that if it is helping cellular function, that it could promote more regular cycles. If it's supporting fertility, it could promote that, but everybody's reaction is going to be so different, right? But honestly, going back to the basics, the recipe to your health and tracking your symptoms. All right, and that's a wrap. So I'm really looking forward to the rest of the season. I hope you are too. I'm going to keep you guys updated on socials as far as when I am releasing these, and feel free to leave comments, ask questions. Please, if you're interested in sending a voice memo and you want to be featured in the podcast, if you have any question about women's health, it doesn't have to be related to anything that we've talked about, please feel free to send it to me and we'll feature you on the show. And Happy New Year, guys. Happy 2026. And I will see you next time.